First speaker is Shilo Jama. He is a current active heroin injection user. He's also one of my very dearest friends. I want to share a little bit about what he means to me very briefly without taking away from his time, because I think it's really important to acknowledge that people who use drugs have a lot of other attributes as well, more than just the fact that they use drugs. Several years ago, when my mother was dying of cancer, I couldn't attend all of her chemo appointments with her because I had to work. And every week for a year, Shilo went to the hospital and sat with my mother while she got chemo and brought her lunch every week for a year. By the end of that time, well before the end of that time, she had started introducing him to her nurses as her son. And that's what he means to me and my entire family now. He is his family to us. In addition to that, he is a professional and personal mentor. I started working with him about 8 years ago, and he has influenced my life more than anyone outside of my blood family. He is the person that taught me that because of who we are and what we say, people are always going to assume the worst about us, and they're going to pounce on any little mistake. If one of us is late or has a cough or makes a mistake, it's just because we're stoned or something. And so that means that we have to wake up earlier, we have to arrive first, and we have to leave last, and we have to do all the research so that nobody can argue with us, and so that we have because they're going to, because everything that we say is going to push a lot of people's buttons, and they're going to try to push back on us. And so because of this man, that's why I do all the meticulous research that I do. And he's also a very proud, active drug user. So let's welcome him. Thank you.
Wow, that is an amazing introduction. I would like to tell you a little story though around two of my favorite people, Joel and Ria. When I was a director of the University District of Change, and I'm the co-founder of the People's Harm Reduction Alliance, which is the largest needle exchange program in the country and is run by drug users. It's a peer-based program. And before I'm going to start talking to you about drugs and how people use drugs, because I think it's really important in every moment you deal with a patient or deal with a friend, that you need to know what is the safest way to use them, what is the least safe way, how to help educate people, because there's a lot of fear and there's a lot of misnomers, and what people usually say is drugs are bad. They don't really say, okay, it's really important to use a cotton, for example. But as a drug user, I have had to be closeted most of my life. I've had shame, and if you heard Ria speak earlier in the pre-conference, she came to me once, and she's a very close friend of mine, and she told me that I was her hero. And I thought in my head, how could I be a hero? I'm a drug user. And I turned to Joe, and I talked to Joelle about this, my close friend, and said, how could I be a hero? I'm a drug user. And she looked at me and she said, every day you tell people to be proud of who they are. Every day you tell people to not live in shame. And why can't you be a hero and a drug user? And so two of the folks who state that I mentored them, on that moment, they were my mentors. And I think we never stop learning, and we never stop being educated, and we never, every single moment, whether we work a program or our life, we are going forward. And if we feel like we've learned it all and we've gotten everything down, the only job left is to die. So I'd encourage everyone to keep learning. So, this is a picture of just lots of different drugs, lots of different paraphernalia, and I'm going to just hit the next slide. And so we're going to go through all the things that you need to know around safe use. So right here's some straws, and so we're going to go through a couple things. So most people think of drugs by how you use them, not what they are. For example, you could use Oxycontins, which is essentially an opiate, right? And so you are an opiate user, whether you're getting it prescribed or Thank you. Either prescribed or unprescribed. So you are, in our society, you are kind of a person who's just taking a pill, like many times, and then, but if you start, let's say you start smoking it, like the opium, dens that we, used to have, then you're a different place in society. You're like, okay, you're not necessarily a good person because you've now taken it in smoking. Now, and if you inject it, then you have terms like junkie, scum, worthless. These are things that people describe me and many people in the neighborhood that I grew up in as, but we use the same substance that you use in the pill form. And so like cocaine, you'll get all these things when people talk about, in college communities and stuff like, oh, it's great to snort, but, you're really fucked up if you smoke it, right? Well, why? Well, it's the same drug, it has slightly different engagements and effects and can make you higher or lower, and then you end up, and so as you as a drug user, if you don't use enough drugs, it's not very fun, and if you use too many drugs, it can be really scary, and it can be an overdose. You're kind of looking for that just right moment, right? And I think when we talk about drugs, we also miss the fact that we have this war on drugs, but what we really should be having is war on trauma, because most people who are in chaotic use of drugs, and the way I kind of classify, there is stable use of drugs, and so I think a stable use of drugs is I can afford a chai tea from a Allegro cafe in my cafe. I walk in every day and I get my chai tea. That chai tea is not going to negatively impact my life necessarily. This job's not going to make it so I miss work. All of these things are going to happen. So I am a stable drug user, right? A chaotic drug user is someone who they have to wake up every single day and they have to focus on that drug. And they have to get that drug and they have to hustle for that drug. And then everything else is secondary to either getting well or getting to that drug. They're in chaos. And that chaos is usually come from trauma. For example, there's a young woman who came to our program who was a university student, and our site is next to a university. And she started coming and getting syringes, and I started talking to her, getting to know her, and she told me about how she was raped in college, and that she tried to make a complaint, and then college didn't believe her, and so she just couldn't deal with the pain. There was no services for therapy, so our friend told her about Oxycontins, and so she started taking Oxycontins, and then she started, losing that supply, and she started shooting heroin. So all of this happened because of this trauma that we could have recognized and could have worked with and could have gotten services for, like mental health services, right? So, I just want to get some background on all of this stuff. So working with folks, this is one of our newest things that we hand out at our program. These are straws, and so what we do is we give people these packs of different colored straws, because if you're gonna, it's gonna be a little scatterbrained because the pictures aren't in order, but I'm gonna go through them as best I can. So if you're going to snort cocaine, you can snort methamphetamine, you could snort heroin if it's in powdered form. A lot of people will crush up pills and snort them, right? And so what people usually do is they get this dollar bill, and they get this thing that, like, think of it as been in my dollar in my pocket could have been a half a dozen of used hands and ground and spit and everything, and I'm really going to shove that into my nose and snort through it, and with all the little blood vessels that can be bursting right then and there, there's thousands of different things that could happen. So what we did is we said, oh, we're going to get clean straws, and so let's say me and two friends want to snort cocaine. I can take them. I'll take all the pink straws, right? And you can have all the yellow straws. Well, we know they're clean, right? And so, and we usually get several different, like, might have 2 or 3 pink straws, and so we can have this system where I can, know my color, so I can know every time which is mine, right? I won't be sharing straws, we won't be passing straws on, it's a clean surface. And this is a little scooper, so people will put cocaine right here, and they'll just literally scoop it into their nose. And then we also could put a plastic card, it's almost like a fake credit card, down to have a clean surface. So you can have a clean surface. So there's all these different things in just snorting cocaine, which people you see on TV, and you think of culture, how you do it. There's all these things that could go wrong in that drug, and in using it. So let's see. All right. So then we have crack kids. Now, the one thing I love to tell this little piece. So when we started handing out crack kits in our program, our Chamber of Commerce president called us and said, I'm confused why you're handing out crack pipes. I didn't think there were that many black people in our neighborhood. And this one should not surprise you. Whatever community you're in, they're using drugs, right? So, and whatever, if you're serving a Caucasian community, guess what? Most of your clients are going to be Caucasian. If you're in the international district and you're serving people, you're going to have a lot of Chinese, Vietnamese people who come to your service, right? So drug users look just like you. In fact, if you look around, you're probably looking at lots of different drug users that you don't even realize, right? So what we did is we got a long tube, right? So most people were buying these long cylinders right here, they're glass, and what you might have common with them is crack pipe. Most of the people were buying them from these stores. They didn't really care about them. They weren't heat resistant. They were cracking. They were breaking. You know. Then you were ending up with cut lips, which then it's passing that pipe, and so it's blood-to-blood contact with cut lips, and so all of these risk factors. So what we did is we got everyone this long cylinder, and what it was is it heat resistant. And so most drug users think they want Pyrex. And Pyrex is a kind of glass that heats up slowly, but then stays hot long, right? So guess what you end up? A lot of crack users will end up with these burnt fingers, right? That doesn't seem very safe. That doesn't seem very healthy. So what we did is we got this glass manufacturer to make this glass heats up quick, but cools down quick. So you can get the heat and the high that you want, but then you aren't doing any risk factors. And we have this little rubber tube. We have a different kind, the sort of trick at the end, and you hold it from the rubber tube, make it so you don't burn your fingers, right? And then this is Brillo, and if anyone has ever scrubbed or anything that the Brillo has, that is literally what that is. You can also take pipe screens and you can mash them up together to do a filter. And so with the pipe screens, the difference between a Brillo and a pipe screens is the Brillo, you use them as a filter. So you put the Brillo right here, and you can kind of put the crack rock right here. I don't know if everyone can see this. And so it's kind of a filter system. With Brillo, the nice thing is are the kind of unfortunate risks are little pieces of it over time, and I mean time as it can reach just via several rocks, can break off and go and then burn the back of your throat, leaving open sores at the back of your throat, which can lead to many different kinds of infections. Right? And so pipe screens, what they do is they don't break off very much. And so some people prefer that, but what they do is when they finally are done, you suck them straight up and you get this big red hot ball burn on the middle of your tongue. Right? So important is to switch them out more frequently. And these are important conversations. So a participant, a client is telling you they smoke crack. It's really important to find out, are they using Brillo? Are they using screens? Are they using the proper glass pipes? These are all things that can negatively impact their health, right? And so then what we have right here is we have a pusher, which is literally just a half a chopstick. And what it does is people will push their Brillo or screen back and forth to try to get the residue to get this in. And it's also very helpful to get the screens in. And so that's just like, if you think about it, there's so many different things that you need to be prepared to have a conversation with. And you got to get real with people. And you got to get very in depth because these are people's risk factors. Okay, so let me see.
Why do people need to use screens in the first place?
People need to mainly people need to get screens in the first place to make sure the rock doesn't get sucked up into your mouth. So we're also going to go through. Let me see. I'm trying to. Unfortunately, they're not in order. Yeah, that would be awesome. I'm looking. Do we have a picture of a needle? Okay, so this is, I don't know what happened. Yay, technical differences. So as I imagine, how many people are in the medical field that know what a syringe is? Okay, so I think everyone can understand. So most injectors use insulin syringes. They're 1 cc. Most people syringes. They're 1 cc. This is a 3 cc syringe. These are usually used to administer naloxone. And naloxone is an opiate antagonist that stops overdoses. It's okay. And so when you are injecting, so most people in the West Coast is using tar heroin with a little powder, and the powder can be more in the South area. And as we talk about opiates and injection, it's also really important to know that, I'm sure you've heard about the opiate crisis, the fentanyl, there's all these technical things. I bet you didn't know that most people on the West Coast don't use opiates. Most people use methamphetamine. And we don't talk about methamphetamine. We don't have a drug to help you quit methamphetamine. We don't have a lot of research when it comes to working with methamphetamine. There's not a lot of treatment options for methamphetamine. And so you're going to start hearing in the news in a couple of years that we have a methamphetamine crisis that we saw coming completely, and we chose to do nothing about. And so anyone in public health, anyone in the medical field, it's really important that you come up with a plan on how to treat methamphetamine use, whatever you go with. So when you have a syringe, you need to have it sterile. If you're using, some people will use, if they don't have access to a syringe exchange, they'll be using dirty syringes, and it'll be a syringe repeatedly over and over, and it can be shared with, for example, if a lot of couples naturally share syringes, so like if me and Joelle with partners or a couple or anything, could be sharing the same syringe. So whatever infections I have, she has, and sometimes we'll both, when talking to people like, oh, well, I have Hep C, and I know Joelle has Hep C. Well, we could have different kinds of Hep C. So it's really important to always use some clean equipment. Do you want to do a cooker? And so a cooker is essentially a means to hold your drugs. And so what it is you need to create a solid into a liquid. And so most of the time, if it's powder, it just naturally dissolves, but if it's tar, it needs heat. And so a little thing in the West Coast that people are always interested in, we have less bacterial infections than folks in the East, and less abscesses and all of these things. And that is because we have really crappy tar. So you have to heat it. And the East Coast, what they'll do is they'll put powder in the back of the syringe, they'll shake it up, and they'll use it. So whatever was in that powder is now going into your veins. Where we have tar, so you have to heat it up, and so because of that thing, that heat is killing enough stuff to have less infection. Now, so cottons is a filter that people use because with tar, it's cut with many different things. Things that are not water soluble is not what you want to put in your vein stream. So the cottons essentially is a filter system to catch that system, and you got to put the syringe right in the middle, and so it can be the best thing. And the other thing is most people touch their cottons, and they put all of their bacteria in their fingers straight into their bloodstream, right? And so it's important to not touch the cottons, and also ask where they got those cottons. If it was from a needle exchange, how do they package those cottons, right? If they just put their hands, it's important to ask these questions. Just like if you went into a tattoo shop and someone just started putting on a needle on you, you'd be like, did you use a clean needle? Was that a needle from the last person that you gave a tattoo? It's always good to ask these questions. And so, do you want to get pipes next? So this is a meth pipe. And the one story, we're one of the few programs that hand these out. And so we did a survey and asked our population, what, if we offered you pipes, would you reduce your injection use, right? And as an injector, people say yes. Now, this is where you really find out if you met one drug user, you've met one drug user. Because my experience is not the world's experience, right? As an opiate injector, I was like, no way are people going to go to smoking. You get less high, you get less, you're wasting money, right? All this stuff. But again, when we talk about, if you use less drugs, if you don't use enough drugs, they're not very fun. And if you do too many drugs, they're really scary. So everyone has their own middle point. And so many of our participants were grabbing syringes because they didn't have access to pipes. So, and if you're a perfect injector compared to a perfect smoker, injection is actually safer. But no, we don't live in a perfect world, right? And so it starts curving really far towards smoking as we get this, because you're less likely to get hep C, less likely to get HIV, and what our participants started aggressively switching to pipes. And the reason they did that is because they wanted to make their medical appointments, they wanted to make their job appointments, they wanted to make sure they could get around, and so everyone started switching to pipe and using less. So just us offering that thing, and that is literally offering it, nothing else. That engagement alone reduced people's use, right? And so when we talk about meth pipes, most people, there's two schools of thought. One is you put the meth in a little tiny bowl, and the meth to here, and the other is you put it in that spout and you drip it down. And lots of people have lots of different theories around it. I think it's point A to point B, the fastest route is one I usually recommend. And then people will take a lighter and they'll do these 45-degree angles to try to get to distribute the heat, right? And they'll take these things and then it'll be coated with this white powder, right? And so one of the things also to understand and to educate people is what's in the methamphetamine. So in Washington right now, we had a whole batch of methamphetamine cut with bath salts, right? So we have these long-term meth users having these mental health crises, right? And so it's really important to be testing that stuff. You know, we had a doctor in Seattle who kept having these crack users come in and they were having all this immune depression, right? And he sent a crack pipe to his lab and he says, yeah, I want it tested. And they tested it and it said it had a lambsol in it, right? Which is a deworming agent for cows. But it dropped their immune system in heavy use, right? And so then he contacted me and said, you know, we need to figure out a solution, you know, and we started doing, for a while, we did lambsol testing kits. Now again, the complication is, I just bought crack, and I just tested positive for lambsol. Am I going to give the crack back to the dealer and say I want new crack? Am I going to throw the crack away? No, I'm going to use it. So the harm reduction answer is really, you need to control your use a little more. You need to have, because if you go on these big runs, you could have these immune deficient issues. And if that's what you're going to do, then you also need to know, be prepared to check yourself into a hospital, right? So the one thing I just want to check in real quick, since it's been a long time, is there any questions that people have that are technical that people want to know really quick before I do it?
I just have, so you mentioned all the time you're handing these out concept.
Can you repeat the question?
I wish lots of people...
Repeat the question, please.
What?
Repeat the
Oh,
question.
she asked me how we're handing all this stuff out, how do we fund it, right? So the initial crack pipe program was funded out of my own pocket, just so we could start it. And then we got some grant funding for the meth pipes and the crack pipes. The syringe exchange gets funding from the health department, will give us in-kind something, and I've grabbed a whole bunch of conservative donors that donate to our organizations. One of the things I've always said is if everyone's asking money from the same source, then you're in tip-stuff competition. But if you're asking for funding from people who've never funded your program, and you can get secure funding, you're the only one they're going to be funding, right? So you kind of secured that funding. So it's always that hodgepodge of stuff. And we have programs that are funded programs, and then we have programs that are unfunded programs. And how we do it is we're much more of a federation. And so we have lots of programs, some of which are anarchist collectives, and some of them are just 2 or 3 people who are just in the community doing it. I think it's also, the thing that's most important is we have these institutions now, but these things went on pre-institutions. People used needles before the institutions existed, right? So we had a Vietnam vet in our neighborhood who worked in construction. He actually helped build Bill Gates' house. And he saw his friends and people he cared about in the neighborhood dying, and he wanted to do something about it. So one of the things he did is he drove down to Tijuana and bought thousands of vials of naloxone in early 90s to 2000, early 2000, when it was illegal to get, and he started distributing naloxone, which is now a widely available program, right? He also started having people kick at his house, and he'd take care of people in his house and kicking his house to help get them treatment and get them support. He also started he was doing his own groups in his house of just friends he was having over. And so these institutions were created not by, researchers and all these. The researchers just find out what already exists most of the time and then implements it. And again, we talked about the first needle exchange program in the country. It was the first drug user who handed a clean syringe to their friend. Right? That was the first program. And I think it's really important that the smartest people in the world when talking about drugs are typically drug users. Right? But it's also important to work with scientists and work with research and find out what's really going on in the community. And one of the things that research can happen is most people in naloxone do this shotgun effect. Give it to everyone, which is great, but if you have a limited supply, and this is where the harsh reality is, you get to decide who lives and dies. And so, guess what? Wealthy communities seem to get those programs before poorer communities, right? And we need to figure out, is it black men in their 60s who are having overdoses? Or is it white Caucasians who are set in their early teens having overdoses? So there's where research can partner with programs, And one of the rules we have in our program is we don't ask questions we don't plan on doing something with, right? We don't ask questions that it's just nice to know. We want to be able to implement these projects and these things. So I think I saw someone else's hand real quick up.
Could you go over a little bit how you use the cotton to sterilely inject?
Okay, I can do a quick demo, and unfortunately, we wanted to do this in a way that people could see, and so that's why the pictures came in last second. But I can do these demos right here. The way you would safely inject is you would find a clean surface. So right now, this could have all the bacteria. It's probably not been cleaned, so I already know it's not clean. Right? Then you have we'll call this my heroin, this nice hulls. And so you break off a little piece of your hulls, you put it in the metal cooker. This is, we're not in ideal circumstances, but again, drug users are not using in ideal circumstances. There isn't a safe injection facility that exists in this country. So the back alley is the unsafe injection. The bathroom at McDonald's becomes the unsafe injection space. Okay? So you have the clean syringe. Ideally, it's going to be clean. So we're going to need to add water, right? And so we're going to break off this water, right? And this is ideal because this is fairly sterile. Most places give out literally water that was from a sink or from a filter, and it's sitting in a sealed place, in a warm place, and then maybe people put it in their pockets, and it gets to hang out there for a long time, and they keep using it, and guess where bacteria gets formed, and so again, you end up with all these bacteria infections. So you take your little syringe, and this is the fancy water, So when you have tar, the issue is you have to cook it off a little, and so you then fill up, and you have to go slow because it's. I hate these waters. So then you would get up to 1 cc, is usually, and then you would put it in your cap. And then what we don't have is most people have paper clips, and they'll hold paper clips so they don't burn their fingers, right? And so then they would heat the source up with some sort of lighter, right? Until it became liquid. And a lot of people, what they do, and this is also good to know for your own things, they take this back thing and they'll mash it up and do this, but then, this is fairly sterile, but it's not going to be sterile for very long. And this is, again, you just put your fingers on the back of the plunger, which is going to go into the syringe that is going to go into your veins, right? So once you've done this, you put the little piece of cotton in, you pull it up slowly, and you try to get the cotton in the middle. And the smaller cottons that I find are more tightly woven, and the bigger cottons are less tightly woven. So biggers are easy to use, smallers are harder to use, but better filters to it. right? And then I always, and this is something that I always teach doctors how to put on ties, and for any nurses out there, you might appreciate this. Doctors seem to very fewly know how to put on ties. It seems like they learned that in medical school, but then forgot it quite quickly. And so I once taught a group of doctors on how to put on a tie, and he looked at me and said, "It's not possible. That can't be done." Right? And I was like, well, it's done every day. So the way I teach people to put on ties is you take 2 fingers right here and you hold it real tight and you pull down and you come up and then you wrap across and then you put your 2 fingers in and you have it. And then you let go, and what you do is you're going to have your needle at a 45-degree angle towards your heart, wherever your heart is, right? And then you're going to do it, and you're going to have to put this in your mouth. And once you put it in your veins and you back the plunger up and you've noticed blood, you've registered, then with your teeth, you're going to release the tie, and you cannot move your arm or anything like that, and then so you can fully inject, right? And the problem is and the reason you use a tie is because it makes, if you have a half-deflated balloon, and you put a hole in it, it's going to make a bigger hole than a fully deflated balloon. So you're doing less damage to your veins. And so it's important to kind of save your veins for as long as possible. Because you want to do as few damages as possible. And I think it's also important to talk about that very few people are going to be a drug user the rest of their lives, right? And so you might use opiates for a short amount of time. Yes?
No, I guess what?
I'm sorry. You might use opiates for a short amount of time. And so you don't want to get HIV, hepatitis C, lots of scars from abscesses, because that's going to always negatively affect your living. And, former drug users end up having this almost this secret society of support, you're one of us, right? And we can support each other, and we can do this. And they look out for each other because we become a team. And ironically, what drug users have in common is really nothing. What they have in common is the fact that we've declared war on them, and we've had laws that make life more difficult for them. And again, I'm an active drug user. I'm a white male. I'm an executive director. And I grew up in the streets in Seattle, and many of my friends died. And I had many folks that were of color and women, and you know what? They died, they suffered, they went to jail, and I kept getting promoted in the system, and I would go into meetings, I'd be super mouthy, and I would tell officials to F off, and I'd get away with it, where my peers would not, and I slowly went through ranks. And the last thing I would like to say is, white men get to become directors, why people of color end up in jail or death. And that's the reality of the drug war. And so I think it's really important to engage people right where they are, and to not pretend like there's not drug users who are in different circumstances and different situations. And it's really important to talk to, especially with pregnant women, around all of these risk factors and give them the knowledge. Because if you lie to them and they find out, they're never going to believe a word that you say. But if you tell them and you say, I want to support you, I know, give them their options. They can go to Suboxone, they can go to methadone, they can go to inpatient treatment. We'll give them all of their options. Be science-based. Tell them that you are concerned about it. Give them unconditional love. Tell them that they're loved. Because so many drug users have lived so many years without love and without being told it. And ask yourself, when was the last time you were told you're loved? And what if that didn't happen? Right? So it's really important every moment in folks' lives to be there for them and to be solid support for them and be their rocks. And if you unconditionally love them and you do whatever you can to help support them and help them heal from their treatment, you're the person they're going to ask for help. You're the person they're going to communicate. They're going to have the honest relationship with you. And that is how lives get changed.